Hello, welcome to our sports news and our short segment on steroids with Joe Krasinski.
Hello everyone, and welcome to our sports newscast tonight. Many of you lately have heard many stories about steroids and what athletes are taking and why they're taking it. Some of the more well-known steroids are Anadrol, Durabolin, and Winstrol. You could either swallow them in tablets or they can also be injected. Many of the users also take different types of steroids in combination with other drugs, which is known as stacking. There are also several symptoms that come along with taking steroids, such as acne flare-up, mood swings or depression, aggressive behavior, or premature balding, like me here. There's also many drug tests that are taken, both professionally, collegiate, and some high schools as well. Oral steroids can be found in your system up to several weeks after your first use. Injected can be found several months after your use. Short-term consequences, well, they can increase muscle mass, strength, and endurance, but can also cause liver tumors, jaundice, water retention, and high blood pressures. Uncontrolled aggression and violent behavior is often known as roid rage, which I'm sure most of you have heard before. There's severe mood swings, manic episodes, and depression. Long-term consequences. The body experiences a buildup of steroids in its system. Conditions such as hypertension, high cholesterol, kidney disease, stunted growth, and heart damage are likely to occur. One other thing that it could affect is your heart. The steroids abuse has been associated with cardiovascular disease, including heart attack and stroke. These heart problems can often happen to athletes under the age of 30. Steroids are illegal for people to possess under the age of, or any age, excuse me. Doctors prescribe steroids for specific medical conditions. They're only safe with the prescription of a doctor to a patient. The majority of teens are not using steroids. Among teenage males who are most likely to use steroids, only 1.8% of 8th graders are currently using steroids. 2.3% of 10th graders and 3.2% of 12th graders have all admitted to using steroids in the past year. Now we're going to go to a couple of callers here and see if they have any questions for me on their view on steroids.
Are steroids addictive?
Yes, they can be. Withdrawal symptoms include mood swings, suicidal thoughts or attempts, fatigue, restlessness, loss of appetite, and sleepiness.
How long can steroids stay in your system?
The length of time that steroids stay in your system varies. Injected steroids may be detected in the body 3 to 4 months, while the oral types may remain in there for approximately 1 to 4 weeks.
What can you do in sports to excel without the use of steroids?
Well, that's a good question. You can focus on getting a proper diet, rest, good overall mental and physical health. These things are all factors in how your body is shaped and conditioned. Excelling in sports is achievable and done by millions of athletes without relying on steroids.
And what are some of the slang terms for steroids that people use?
Good question. I know that a lot of you go to the gym and you hear some of these slang terms used and you want to know what they are just in case. Some are Arnold's, gym candy, pumpers, stackers, weight trainers, and the most widely known name, juice. Thank you for joining us today on our sports news on our take on steroids. Please tune in again tomorrow and we'll inform you some more. Thank you.